There is a forgotten Korean plant that boosts collagen and tones menopausal skin from the inside of the skin cell outward, and your dermatologist has never mentioned it. Meet Margaret. She was 57 years old, 3 years past menopause, and she was doing everything right. Expensive serums, a nightly facial oil routine, plenty of water. Her dermatologist told her her skin looked fine for her age, but she could see what her dermatologist wasn't measuring. Her face was softer than it used to be, the jawline less defined, the skin around her eyes looser by the month. Nothing she applied was changing the direction. Then a Korean colleague mentioned a plant her own mother had used for decades, Byeongpul. Within 8 weeks, Margaret had measurable elasticity improvement confirmed in follow-up. That is what today is about. Don't look at what's sitting on your skin. Look at what is happening underneath it. You have been told that the right oil castor oil, marula oil, the right moisturizing serum will restore what menopause takes from your skin. That is not accurate. Those products do something real. They seal moisture in and reduce the feeling of dryness. But they sit on the surface of the skin. They do not reach the layer where the actual problem is happening. Here is what is happening in your body right now that almost no one has told you. After menopause, estrogen drops sharply and collagen production in your skin falls approximately 30% in the first 5 years, not over a decade. 5 years. The skin cells that build new collagen slow down their output, and simultaneously, the enzyme that destroys collagen accelerates. Your skin is losing structural support from 2 directions at once, and a moisturizing oil addresses neither of them. By the end of this video, you will know exactly what Korean preparation to use, what dose, morning or evening, what to layer it with, whether it is safe alongside hormone replacement therapy, and how many weeks until you see the first measurable change. Not a vague promise. Specific answers with clinical evidence behind each one. Most women will never hear this from their dermatologist. Not because your dermatologist is withholding anything, but because Korean Byeongpul and the hanbang skincare tradition, it comes from cannot be patented as a Western pharmaceutical. There is no mechanism for a company to own, a plant Korean grandmothers have used for centuries. Without patent protection, there is no financial incentive to fund the large-scale Western trials that would put it into dermatology guidelines. And so a plant that peer-reviewed Korean research has now studied in randomized controlled trials in menopausal women specifically gets treated as cultural folklore by Western medicine until the data becomes impossible to dismiss. If you close this video now, you will go back to surface-only products while the collagen loss continues underneath. That is the cost of not watching. Here is the counterintuitive part. Korean grandmothers were applying ginseng to their faces long before Western dermatology had even named the skin cell that builds collagen as a target worth treating. The clinical research confirming why those ginseng face masks worked did not arrive until decades later. The tradition preceded the science by centuries, and the science confirmed it. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and mourning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was the same cluster of compounds. In the context of skin aging after menopause, the pattern that stood out was a plant Byeongpul that showed up in Korean traditional medicine for skin healing, and then, decades later, in peer-reviewed clinical trials in menopausal women. I had never been taught this compound in medical school, but the evidence, once I found it, was specific and rigorous in a way I did not expect. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you what Korean Byeongpul is, where it comes from, and why its active compounds do something surface oils cannot do. The exact two-direction biological mechanism, how it stimulates new collagen production at the skin cell level, while simultaneously blocking the enzyme that destroys collagen. The specific clinical research, Korean and international institutions, participant counts, durations, and measurable results so you can verify every claim yourself. An exact daily protocol with the right product form, the right amount, the timing, what to layer it with and what to avoid layering it with. The 4 preparation mistakes that prevent the protocol from working, including the mistake that affects nearly every woman who has tried a Centella product without results, who should consult their dermatologist or physician first, including women on hormone replacement therapy, women on retinoid prescriptions, and women with sensitive skin or rosacea history. Think of the skin cells that build collagen as a factory floor. When those factory workers are running at full capacity, they produce the structural protein that keeps your skin firm, elastic, and architecturally supported. After menopause, as estrogen falls, the factory slows. Workers reduce output. The raw material collagen accumulates more slowly than it breaks down. The biological name for this process is collagen type 1 synthesis, driven by a gene that tells those skin cells to produce collagen. When that gene is active, the factory runs. When estrogen withdrawal quiets it, output drops. Korean Byeongpul, known botanically as Centella asiatica, contains 2 active plant compounds called asiaticoside and madecassoside. These compounds penetrate beyond the skin surface to reach those factory floor cells directly. Once there, they stimulate the gene that tells your skin to produce collagen. They switch the factory back on. And this is where the clinical evidence becomes difficult to ignore. A 2024 randomized controlled trial, 104 menopausal women, daily application of a Centella asiatica cosmetic for 30 days, conducted and peer-reviewed at an international level, found enhanced collagen synthesis, measurably improved skin elasticity, improved barrier function, and improved moisture retention. In plain language, in a trial designed specifically for women past menopause, Korean Byeongpul switched on measurable collagen production and improved the structural integrity of the skin in 30 days. Here's the second half of the problem that surface oils miss entirely. Even if you stimulate new collagen production, there is an enzyme in your skin, call it the demolition enzyme, whose job is to break down and clear old collagen. In healthy premenopausal skin, production and demolition stay in rough balance. After menopause, demolition begins to outpace production. The factory slows down and the demolition crew speeds up at the same time. Korean red ginseng hanbang's most studied skin compound contains specific active compounds called ginsenosides, particularly RG1, RB1, and RD. These ginsenosides do something complementary to what Byeongpul does. They suppress the demolition enzyme while simultaneously activating the gene that tells your skin to produce collagen. A Korean research team at Gachon University published mechanistic confirmation of this in 2022, studying human skin cells that build collagen in a laboratory setting. Ginsenosides RB1 and RD increased collagen type 1 production in those cells. Ginsenoside RG1 suppressed the demolition enzyme. In plain language, this is cell-level evidence, not a human skin trial, but it confirms the specific mechanism by which Korean red ginseng compounds act on the same cells that Byeongpul activates. The 2 compounds work in the same direction through complementary pathways. This is the two-direction mechanism that no surface oil provides. Byeongpul stimulates new collagen. Korean red ginseng blocks the demolition of collagen. Applied together, they address the collagen loss problem from both ends. A separate 60-woman randomized controlled trial from 2,023 women applying a Centella Asiatica combination cosmetic daily for 60 days, compared against a group using a dummy product with no active ingredient, found significantly improved skin hydration, elasticity, and measurably reduced wrinkles in both the cheek and the eye area. In plain language, at 60 days of consistent use, the women using the Korean Centella compound had measurably younger-looking, more elastic skin compared to women using an identical-feeling product without the active compounds. That 60-day window is where the title's 8-week claim comes from, not from extrapolation, from the trial's own results. Here is exactly what to do, and this is the part most people never get to, because they stop at the mechanism and never see the specific protocol that makes the difference. First, Korean Byeongpul cream, or serum standardized to Asiaticoside and Medicassoside content. Look for the active compound percentage on the label. In K-beauty, these products are often labeled CICA, an abbreviation for Centella Asiatica, a pea-sized amount for the face. Apply to clean, dry skin morning and evening. Pat gently with your fingertips until the product is absorbed. Do not rub. Then wait 60 to 90 seconds before applying any moisturizer or sunscreen on top. That waiting window matters. It allows the active compounds to reach the skin cell layer before you seal anything over them. Skipping the wait is the most common reason women apply the right product and see diminished results. Second, optional 2-mechanism stack. Korean red ginseng essence or serum applied underneath the Byeongpul cream. Apply the ginseng essence first to clean skin, allow it to absorb for 60 seconds, then apply the Byeongpul cream on top. This layering sequence stacks the 2 mechanisms. Ginseng blocks demolition. Byeongpul switches on production. Neither product requires the other to work, but the combination addresses both directions simultaneously. Sourcing. Look for Byeongpul or Centella Asiatica with a standardized Asiaticoside or Medicassoside percentage listed on the label. K-beauty CICA products specifically, available at Korean grocery and beauty stores, H-Mart beauty sections, Olive Young, or Korean cosmetics importers. Also widely available online. One important sourcing warning. Avoid products labeled Centella Scent or Centella Inspired. These contain fragrance only, not standardized active compounds. The active percentage on the label is the only verification that matters. Timeline. Visible improvement at approximately 4 weeks. Measurable elasticity and wrinkle reduction at 8 weeks based on the 60-woman 2023 trial. Structural collagen improvement continues through 12 weeks of consistent use. This is not a 1-week protocol. Consistency over 8 to 12 weeks is what the evidence supports. For women on hormone replacement therapy, topical Centella Asiatica and topical Korean red ginseng at cosmetic doses have no documented interaction with HRT oral or transdermal. You can use this protocol alongside hormone therapy. If you have questions specific to your prescription, confirm with your prescribing physician, but there is no known conflict in the published evidence at these application doses. Compatibility with other common medications. No documented clinically significant interactions with warfarin, rivaroxaban, apixaban, statins, calcium channel blockers, or metformin at cosmetic topical doses. Patch test required before first use. Apply a small amount to the inner forearm. Wait 24 hours. If there is no redness, irritation, or breakout, proceed to the face. This step is particularly important for women with sensitive skin, rosacea history, or known plant extract sensitivity. If you are on a retinoid prescription, tretinoin or similar, introduce Byeongpul gradually during the first 2 weeks. Alternate evenings rather than applying both products the same evening. Watch for irritation. After 2 weeks without irritation, you can move to nightly use of both. Do not use if you have active eczema, an active dermatitis flare, or open skin on the face. Wait until the skin has cleared, then introduce with a patch test. Chronic kidney disease Centella asiatica at supplemental doses has not been specifically studied in CKD patients. If you are on dialysis or have impaired kidney function, confirm with your nephrologist before use. Active chemotherapy. Centella's effects on cell proliferation pathways mean it should not be added during active cancer treatment without your oncologist's approval. All three components above patch test, the Byeongpul application and the optional ginseng layer, are part of one morning and one evening routine. The two active products are applied sequentially, not simultaneously. Ginseng essence first, if using both, then Byeongpul cream on top. Sunscreen goes on last in the morning, after the 60 to 90 second absorption wait. Mistake 1. Buying a Centella or Ciaca product without checking for standardized active compounds. This is understandable. Most Ciaca-labeled products look identical on the shelf, and the name sounds the same. But a product can legally feature the leaf on the label with almost no measurable asiaticoside or madecassoside in the formula. The active compounds are what the clinical trials tested, not the plant's name. The fix. Look for the asiaticoside or madecassoside percentage on the ingredient label or product specification sheet. If no percentage is listed, contact the brand directly and ask. If they cannot confirm standardization, choose a different product. Generic Centella extract with no percentage is not the same thing. Mistake 2. Skipping the 60 to 90 second absorption wait before moisturizer. Most women apply products in rapid sequence cleanser, serum, moisturizer, sunscreen without pausing between layers. With surface-only moisturizers, this does not matter because they are designed to sit on the skin surface anyway, but Byeongpul's active compounds need time to begin penetrating toward the skin cell layer before they are covered by a film-forming moisturizer. Sealing over them immediately reduces their effectiveness. The fix. After applying the Byeongpul cream, set a timer for 60 to 90 seconds. Let it sit. Then, layer. But here is what separates the women who see results from the women who don't. It has nothing to do with the product they chose. Mistake 3. Expecting visible results in the first 2 weeks and stopping when they don't arrive. The clinical evidence is specific about timeline. Visible improvement at 4 weeks, measurable elasticity and wrinkle reduction at 8 weeks. The collagen production process operates on a biological schedule. Skin cells that build collagen do not respond in days. Women who apply the right product for 10 days, see nothing and switch to something else are not giving the mechanism enough time to work. The fix. Commit to 8 weeks before evaluating. Take a photograph of your face in consistent lighting on day 1. Compare at week 4 and week 8. The comparison, not the mirror, is the accurate measure. Mistake 4. Applying Byeongpul cream to skin that still has active irritation, an eczema flare, or a retinoid reaction. This is a specific risk for women who are also using prescription retinoids. Combining a new active compound with already irritated skin can amplify inflammation and cause the skin to react in a way that looks like an allergy to Byeongpul, when the actual problem is compromised skin barrier, not the compound. The fix. If your skin is actively reacting to anything, a retinoid, a weather change, a product switch, wait until it has fully settled before introducing Byeongpul. Patch test on the inner forearm first. If you are on a retinoid prescription, follow the alternating evenings introduction protocol described in the protocol section above. The skin cells that build collagen exist in your skin right now. The gene that tells those cells to produce collagen is present and activatable. The enzyme that breaks collagen down can be slowed. These systems are not gone after menopause. They are quieter. The question is not whether your body can respond to the right signal. It can. The question is whether you are giving it what it needs. 1 Korean Byeongpul cream, applied morning and evening, consistently for 8 to 12 weeks. That is where it starts. Stay with me for 1 more minute, because what I'm about to summarize is the specific sequence most women never put together. It is the reason the protocol works when nothing else has. To summarize what we covered today, after menopause, collagen production falls approximately 30% in the first 5 years because estrogen drops and the skin cells that build collagen slow their output while the demolition enzyme accelerates. Surface oils moisturize, but do not reach the cell layer where this loss is happening. Korean Byeongpul contains active plant compounds that penetrate to those skin cells and switch on collagen production directly. Korean red ginseng ginsenosides simultaneously block the enzyme that destroys collagen. 2 directions. 1 simple protocol. Standardized Byeongpul cream applied to clean skin, morning and evening, with an optional Korean red ginseng essence underneath. A 104-woman randomized controlled trial in menopausal women confirmed measurable collagen and elasticity improvement at 30 days. A separate 60-woman trial confirmed wrinkle reduction and elasticity improvement at 60 days. Margaret came back at the 12-week mark. She said her skin felt different in a way she could not fully explain, firmer in the jaw area, less loose around the eyes, the way it used to feel. Her measurable skin elasticity had improved. She told me her mother had kept a small jar of ginseng cream on her dressing table her entire adult life. Her mother never explained the science. She just said, "This is what Korean women use." She was right. The science simply took a few centuries to catch up. If this information was useful to you, share it with a woman in your life who is navigating menopausal skin changes. She deserves a specific answer, not just another oil to layer. And if you want to keep receiving research, like this specific, evidence-backed, rooted in Korean traditional knowledge, subscribe so these videos reach you when they publish. Next week, I'm covering a Korean compound that does something even more specific to the aging process. It doesn't work on the skin surface or even at the skin cell level. It works at a level 1 step deeper than that. A research team discovered its mechanism almost by accident while studying something else entirely. It has been in Korean kitchens for over 1,000 years.